Hello everybody, this is Dr. Hassan Lawati. Today I'll be talking about important concept when you treat patient with osteoporosis by bisphosphonate. Now it is very important to know that you have to consider what we call drug holiday, because if you keep the patient in bisphosphonate continuously for a long time, they will be at risk to get what we call atypical fractures, and you don't want that to happen. So you always need to consider bisphosphonate discontinuation, and that's what we call drug holiday. Now, if you treat the patient with oral bisphosphonate, you should consider drug holiday after 5 years. Or if you treat the patient with IV bisphosphonate, you should consider drug holiday after 3 years. 3 or after 3 years. Now, if the patient got fracture during therapy, then here you have to reassess the risk and consider continuing bisphosphonate therapy up to 10 years. Or alternatively, you can change the type of therapy to another type of therapy. For example, you can switch the patient from bisphosphonate to denosumab, and then you keep reassessing them every 2 years. Now, if the patient is not having any fracture while he is in bisphosphonate therapy, then you need to measure the T-score or frac score. Now, if the T-score was less than minus 2.5 or frac score was high, then you need to reassess the risk and consider continuing bisphosphonate for up to 10 years or changing to alternative agent like denosumab, and keep assessing the patient every 2 years with bone densitometry. Now, if the patient was doing well with low risk of fracture, then you can consider drug holiday while reassessing him every 1 to 2 years, and then based on his T-score or fracture risk, you can then consider to restart bisphosphonate or to change it to another alternative agent. So that's briefly about drug holiday concept in patients who are on bisphosphonate therapy. If you have any comment, please write them below. Thank you.